Hello, wonderful sleepers and aspiring sleepers. As we journey through life, many of us find that sleep, once a natural companion, becomes a bit more elusive. It's a common concern, especially as we age. You might be wondering, is this just normal aging, or is something more serious going on? Today we're diving deep into a topic that affects up to 50% of seniors: clinical insomnia. That's a significantly higher rate than the general adult population, where it affects about 10%. So, if you're experiencing sleep challenges, you are certainly not alone. We'll explore how to recognize clinical insomnia, understand its common causes, and most importantly, equip you with advanced, proven techniques to reclaim your peaceful nights. This isn't just about bad sleep. It's about understanding and addressing a real clinical condition. Many of you are probably asking, is my sleep trouble just a few rough nights, or is it clinical insomnia? It's a crucial distinction, and knowing the difference is your first step towards better sleep. Let's uncover how to tell. Here's how to identify clinical insomnia. If you're struggling to fall or stay asleep 3 or more nights a week, and this pattern has persisted for 3 months or longer, despite having a good sleep environment and enough time in bed, it's a strong indicator, especially if it's impacting your daytime energy or mood. On the other hand, if your sleep disturbances are sporadic, perhaps linked to a temporary stressor like travel or a noisy environment, and they resolve once those circumstances change, then it's most likely just temporary poor sleep. Normal aging also brings changes, lighter sleep, more awakenings. But this isn't necessarily insomnia unless it persistently leads to poor daytime functioning. So I encourage you to ask yourself, how many nights a week do I struggle to fall or stay asleep? Has this been going on for several months? And do I consistently feel tired, unfocused, or unrefreshed, even after a night in bed? If your answers lean towards yes more often than no, you're likely experiencing clinical insomnia, and this video is for you. Now, you might wonder, why is insomnia more prevalent in seniors? A common factor across all ages with insomnia is an elevated level of physiological arousal, which we call hyperarousal. Your body's internal system is essentially running a bit too fast, even when you're trying to wind down. This hyperarousal means your biology is moving faster, your metabolic rate might be increased, and this state often doesn't shut off at bedtime. It leads to restlessness, physical tension, and a reduced sleep efficiency. That's the actual time you spend asleep while in bed. It can be genetic, stress-induced, or even a learned response where bedtime becomes associated with frustration. Before we dive into our 6 advanced techniques, remember this: multi-component treatment plans are proven to have the highest success rates for insomnia, far more effective than medication alone long-term. So, I urge you to consider integrating as many of these strategies as possible for the best results. Our first lesson, and the foundation for all good sleep, is excellent sleep hygiene. It might seem basic, but without it, other techniques will struggle to work. Even in mild cases, good sleep hygiene can be a game changer. Let's start with consistency. Be consistent with your sleep schedule. Your body thrives on a regular sleep-wake cycle. Aim to go to bed and wake up at almost the same time every single day, even on weekends. Also, avoid stimulants and stimulating behaviors in the early evening or night, like caffeine, nicotine, stressful work, or emotional conversations. Establish a relaxing pre-sleep routine to reduce anxiety and transition your brain into sleep mode. Follow it consistently every single night. Consistency is truly your best friend here. And optimize your bedroom. Make it a sanctuary that's quiet, dark, and cool. Nap carefully. This is especially important for seniors. Naps, even short ones, can reduce your sleep drive, which is crucial for falling asleep at night. Try to minimize naps, keeping them under 20 minutes, structured with an alarm, and ideally before 2 p.m. Stop eating 3 hours before bed. For dinner, I recommend a balanced Mediterranean diet, rich in omega-3s. A sleep-friendly diet will not only aid your sleep, but also contribute to your overall well-being. Minimize or eliminate caffeine and alcohol, especially alcohol, as it disrupts REM sleep and increases nighttime awakenings. And make sure to get exercise every day. Not intense workouts, but a consistent 15-minute walk after dinner. Daily exercise, especially for seniors, leads to better sleep. If you're struggling to sleep, avoid watching the clock. This increases anxiety. And finally, don't go to bed too early. Align your bedtime with your natural chronotype. You can find out more at sleepdoctor.com. These 10 habits are your baseline for better sleep. Our second lesson is stimulus control. If you have insomnia, you might unknowingly associate your bed with frustration rather than sleep. We need to retrain your brain to see your bed as a place solely for rest and intimacy. Here's how to do it. First, only go to bed when you're truly sleepy. If you're not sleepy by your usual bedtime, consider shifting it 30 minutes later. Second, if you can't fall asleep within 30 minutes, get out of bed. Go to a designated calming spot in your home with dim light and do something relaxing like reading, then try again. Third, use your bed strictly for sleep and intimacy. No phones, no laptops. Reading is okay, but only before sleep. Don't spend your day reading in bed. And finally, even after a rough night, still get up at your exact same wake time. This consistency is key to reinforcing the bed-sleep association. Our third lesson, and a powerful one, is sleep restriction therapy. It sounds counterintuitive, but it helps with both falling asleep and frequent nighttime awakenings by temporarily limiting your time in bed to match your actual sleep duration. This builds sleep pressure. For example, if you're only sleeping 6 hours a night but spending 8 hours in bed, you'd restrict yourself to 6 hours. As your sleep becomes more consolidated within that window, you gradually increase your time in bed by 15 minutes each week. A sleep diary is essential here to track your progress. Crucially, no naps are allowed during sleep restriction therapy. We want to maximize that natural sleep deprivation to increase your sleep drive. You can resume napping once your sleep is consolidated. Also, your wake-up time must be 100% consistent, 7 days a week. A word of caution: sleep restriction therapy can be mentally and physically challenging at first. It's best done under the supervision of a sleep psychologist or clinician. This is a powerful tool, but guidance is important to ensure you implement it safely and effectively. Our fourth lesson focuses on arousal reduction through relaxation techniques and meditation. The goal is to break the cycle of hyperarousal by calming both your mind and body, creating a runway for a gentle descent into sleep. The research strongly supports their effectiveness. My favorite technique is progressive muscle relaxation. You systematically tense and then relax muscle groups, starting from your toes and moving up to your head. Many people, including myself, find they fall asleep before even finishing the exercise. It's that effective. Another powerful tool is diaphragmatic breathing, or deep belly breaths. This not only calms your body but also forces you to focus, quieting that monkey mind. I often have patients count their breaths, as it's hard to count and worry at the same time. My go-to is the 4 to 7-8 breathing technique. Breathe in for 4, hold for 7, and release for 8. Visualize the numbers counting backward in your head. 4, 3, 2, 1, as you inhale. This helps distract your mind from worries, slows your heart rate, and prepares you for sleep. There are also many guided meditations and imagery exercises you can explore. Our 5th lesson is specifically for seniors dealing with chronic pain, a significant contributor to insomnia. While I can't eliminate the pain, we can minimize its impact on your sleep. Start by optimizing your sleep system, your pillow, mattress, and bedding. Many products are designed for specific pains, like pillows for neck pain or mattresses for hip and back pain. You can find product reviews on my website, sleepdoctor.com. Also, avoid alcohol for pain relief. It's terrible for sleep. If you take pain medication, discuss with your doctor about taking it closer to bedtime, and only with a sip or 2 of water to avoid nighttime bathroom trips. Finally, a simple yet effective tip. Try a hot bath about 90 minutes before bed. It's both sleep-inducing and great for pain relief. There's solid data to back this up, proving that this calming ritual can truly make a difference for your nighttime comfort. Now for the gold standard treatment, cognitive behavioral therapy for insomnia, or CBTI. This structured, evidence-based approach is especially effective for older adults. CBTI addresses the root causes of insomnia, specifically your unhelpful thoughts and beliefs about sleep. For example, you might think, if I don't sleep now, tomorrow is ruined, or I need 8 hours or I can't function, or even, is something wrong with me? These thoughts fuel anxiety and arousal, making sleep even harder. CBTI teaches you to rewire these thoughts and break this cycle. For seniors, it's easy to think, I'm older now, so good sleep is just impossible. CBTI helps challenge these distorted beliefs. It's about replacing catastrophic thinking like, I'll never sleep again, with more realistic expectations, such as, even a bad night doesn't ruin my entire day. This reduces sleep performance anxiety. Instead of I didn't sleep well, so tomorrow will be worthless, you learn to reframe it as, I've functioned on less sleep before. I may feel tired, but I can get through today. Or, instead of I have to try harder to fall asleep, you realize, sleep is natural. The more I force it, the harder it becomes. My job is to relax, not control sleep. Rigid expectations about sleep can lead to frustration. CBTI helps you adjust these expectations, introducing flexibility and trust in your body's natural rhythms, significantly reducing sleep anxiety. You learn to spot these unhelpful thoughts, challenge them with logic, and replace them with calmer, more balanced alternatives. While CBTI is best with a therapist, understanding its principles allows you to start applying them tonight. Remember, the best way to cure insomnia is a multi-component treatment plan. Try these techniques, find what works for you, and stick to as many as you can. They empower you to control your sleep, offering long-lasting results. And don't forget the crucial role your doctor can play. They can address underlying medical issues affecting your sleep and, if needed, discuss prescription sleep medications to help break the cycle of insomnia while you implement these techniques. I've even made a video on how to best utilize your doctor, which you can check out right here. Remember, good sleep is learnable. You absolutely can do this. It takes patience and persistence, but the rewards of a truly restful night are immeasurable. Start today, take these lessons to heart, and commit to your journey towards better sleep. This is Dr. Michael Bruce, the Sleep Doctor, wishing you the sweetest of dreams. If you found this video helpful, please give it a like, share it with a friend, and subscribe to my channel for more insights into achieving your best sleep. Your support helps us create more valuable content like this. Sweet dreams.